Good afternoon, ladies and gentlemen. Great pleasure to have all of you with us at Dhaka, Bangladesh, at the fourth SCAI Bangladesh course. This is a Society of Coronary Angiography Intervention. I'm Ramesh Dagubati. I'm the chair of SCAI from West Virginia University, USA. With me are Mirvat Alasnag, the co-chair of SCAI International Committee, and our international committee members, Mamas from UK, and MG Azam from Dhaka, Bangladesh. So for my first question, I think I should ask you, Dr. Azam, is that how were you able to organize such a wonderful meeting, and what has been the route of success for this meeting in this past 4 years that we have done this meeting?
Okay, well, very well question. Very nice question actually. And all of you know, SCAI organize a meeting, almost always case-based interactive meeting, so that people are really interested to interact with the international fellows and international faculties to know new things and new recommendation and guidelines how to implement in our local setting. That is the key issue. Second most key issue is there is our program designed such a way is it just in our daily practice, which is really matter for our patients service. That's why they are also interested for this. Third thing, there is some hands-on training program is there, so people love to do it in hands-on training. So that's why they are choosing SCAI Bangladesh program very confidently and very nicely.
Thank you very much. And Mirvat, what is one or two things that you felt that have been highlighted at this meeting?
So the importance of this meeting was highlighting local practices, local populations, their risk factors, their disease patterns, and trying to understand how the international guidelines and so on fit and suit this kind of a population. And I think what we've learned is that we do need to collaborate, and we do need to expand our consensus documents and registries to reflect the differences between the populations, the syntax scores, the age, the risk factors, and so on.
And so, Mamas, as you know that you've been traveling quite a bit to every part of the world, and do you see that there is any discrepancy in healthcare disparities or as such in Bangladesh? And how do you think we can make a difference here?
I mean, look, across the world, you see very different healthcare systems and very different challenges, but common themes occur. So, one of the common themes that has really resonated with me in this meeting is access to coronary revascularization, particularly in patients with heart attacks. And you have a situation in that there are big disparities within the country, in that you have centres of excellence, such as Dr. Azam's centre, where you have state-of-the-art treatment, and yet in other parts of the country, there's even difficulty in diagnosing STEMI. And so, a lot of the discussions have been around and trying to develop pathways to try to reduce some of these disparities. Things thinking around, how do we deliver optimal care? How do we deliver guideline recommended care within the confines of a system that perhaps doesn't have the financial resources to do that, but also how to measure quality and capture outcomes in this. There's been a lot of discussions around partnering up with SCAI, developing registries, looking at outcomes in patients with acute coronary syndromes, because if you can't measure something, you can't change something.
Thank you. And Azam, both of our key opinion leaders have mentioned to actually look at the registry population from within this country, and maybe we have to write different guidelines for this region, for this country, rather than just accepting all the guidelines from Europe or America. How do you foresee that implementing research in your institution with the help of your fellows, do you think that it is possible to do such an event?
Okay, if you look at this actually, we don't have own guidelines. We always depends on two region, transatlantic region. One is European, another is US. we are always following SCAI guideline or ESC guideline or SSA AHA guidelines. So actually, daily need we should develop our own customized guideline. So it is, guideline preparation at least needs longer duration, at least 4 to 5 years should be required to develop the guidelines. And it depends on the country's own registered database. So we have some database, not all in real whole country. Some center we have isolated database. So based on our local publications, local registry, local data, then we can formulate a national guideline. So what we can do right now, we can do some consensus statement like that or some regulation like that. That way we can at least set up our standard practice for our all fellows and early career cardiologists. So we have to set our national society also working on it, and SCAI always promoting to ad- advocate this program, and they are always committed to serve this country on the platform of this SCAI Bangladesh program. Already we initiated a lot of programs here. So actually, this is the current scenario in our center, and our center, my center, National Local Obstructive Disease, the largest hospital in this country, and it's second largest hospital in this Asia. We are 1250 bedded hospital, solely cardiac hospital. So we have a lot of facilities, but we are overburdened. But our hospital occupancy rate more than 200%. If our capacity is 1250 bed, everyday patient is admitted in our hospital more than 2000. So we are really overburdened. So that should be addressed first actually, because if you overburden, then you can't work properly. So we are trying to develop our regional centers. If it is activated very nicely, then maybe we can serve better way.
Yeah. No, with my travels that I've seen, at least Bangladesh is, and especially Dhaka, has a dense population, and the number of cath labs are, relatively speaking, less to the number of people that are in the city. And also, the trying to travel to a PCI capable hospital is a concern. And so, pharmacoinvasive therapies are being done, and actually trying to educate people, even though Society of Coronary Angiography is a interventional society, but we believe in prevention and making them, I think, educating people to eat healthy, exercise regularly, and I mean, air pollution is something that we are not able to prevent currently, but trying to make an impact on the general population with the help of the government is very important. And we are happy to partner with you as well as with the societies within Bangladesh to help and educate people as well as physicians. And as I step out as the co-chair of SCAI International Committee in May, and the incoming chair, Dr. Mirvat Al-Asnag, and the co-chair is
Chaudhry
Hafiz
Hafizul
Hassan
Hasan. And I am
Chaudhry.
also the member of this committee up to
SCAI
26.
committee, all of us are international committee members. Dr. Alasnak, how would you see, what is your vision for Bangladesh and this region as the chair of international committee?
So I see us partnering with experts and key opinion leaders in the region, one, to disseminate best practices, so education, starting at the level of the trainees and fellows, to make sure that they understand the basic concepts of safety in intervention and judgment, really, not just the technical skill. And the other one is what we've been talking about here, is that capturing and understanding the landscape of disease in the local population. So really handling large databases, establishing large databases is the way to go. So you can study them. Based on those, we can write and elaborate guidance documents or consensus documents that help continue to improve the practices of intervention and identify areas of need. So is there an issue with structural heart? Is there an issue? Are they underdiagnosing peripheral vascular disease, for example? We haven't discussed it in this meeting at all. Is there an issue with STEMI care? So as you kindly mentioned, that the population is very dense here, and I know you and I were speaking yesterday about having these ambulances or care point of care vehicles in busy corners to allow at least lytic therapy as a transfer to centers with PCI capability. So I think these are the programs that we'd like to invest in as SCAI leaders, and hoping that you will continue your work that you've been doing in this part of the world on behalf of SCAI as well.
Thank you, absolutely. And both of you, including yourself and Mamas, very much involved in research in the entire world. And I think your help in coming up with the consensus statement, as Dr. Azam mentioned, will be very valuable, I think, to the entire community of cardiology community in Bangladesh. And Dr. Mamas, any talk about
I
what
just
is...
give you one example. Actually, during the COVID era, we did a consensus statement how to manage COVID with STEMIC care. So that was widely accepted our ministry, and it is published in WHO as well, our consensus statement, and we followed that guideline. Actually, in short term, I think SCAI can help us, or both of you, the international program chair, and now Hafiz is also co-chair, and I'm also the member. If we wish, if we work together, I believe we can formulate very shortly, at least consensus statement first, then we can go for actually our regional guideline like that.
Thank you. Dr. Mamas, any advice to the young cardiologists how to establish the databases, as Dr. Alasnag mentioned about?
So I would partner up with individuals or institutions that have experience in doing this. There is really not much point in trying to reinvent the wheel, but also think about what the purpose of your database is. So, for example, I lead the UK National Intervention Audit, and ours was really developed to look at differences in practice amongst different centres and to look at differences in outcomes, both at the centre and the individual operator level. So I think it's to study what's out there, what your aim is, what the purpose of your database is, and then work with people that have expertise in this arena to develop your database. The second thing is to work closely with people that understand analytical frameworks. There's nothing worse than developing a database, not speaking to data scientists, and then finding that your database a year, 2 years down the line is unusable. I guess the third thing is to try to think about, how widespread your database is. If you're only going to use the database in 1 or 2 centers of excellence, then I think its utility is not so useful. I think you need to then think about how you're going to adopt the database in each individual region and center in the country, how you're going to fund that, how you're going to mandate that. And that's really a decision much higher up than the individual cardiac societies, but it becomes then a political decision. And in the UK, the Bristol Heart event, where there was excess mortality in children undergoing cardiac surgery in Bristol, really focused the minds of the politicians and made it mandatory to collect data in 10 specialities, interventional cardiology being one speciality, with the national transparency framework, again, making it mandatory for national reporting. So I think whilst, developing databases, is great and I thoroughly encourage it, I think you need to think about the wider picture and perhaps going upwards to more governmental aspects and trying to think about, centralizing the process, financing the process centrally and making it more mandatory, but working with people that have done that before.
Thank you very much. And back to you, Dr. Azam, about the feasibility of what Dr. Mamas was mentioning about working with the government, especially coming from the government institution in your position. What is the feasibility of successful database and auditing the data that you're collecting as well?
Is wonderful issue actually raised, Mamas. Without involvement of government, we never able to success. And government always ready to give service. Actually, what we need some specific target-oriented recommendation to the government. These things should be prioritized. These things should be addressed, and these are the possibilities, the way out of this program. So, if we convince our regulatory bodies, health ministry, I believe they will agree to do it because our honorable Prime Minister Sheikh Hasina, she is the visionary leader. She always ready to serve, improve healthcare delivery system. It is her commitment. But what we need actually, we need SCAI and ESC, SCCI, all top leaders recommendation thought should be, we should incorporate in our thought, and we should utilize it in our own way because our demographics are not always similar to the US people or UK people. We are different actually. Our food habit, our lifestyle, and our economy and our healthcare delivery system actually our patient pay their own pocket. You have some insurance facilities, but we don't have it. Even our government, our prime minister initiated for the mandatory insurance program for every people. So we hope one day we are able to do it, but very short term, we should, as I said earlier, we should make some recommendation actually of what we need, what should we do. We should prepare the statement. Then we send it to our ministry. We can sit together, our ministry. Our minister, as you know, he's a doctor and he's in my same medical school. He always proposed me, if you give me good recommendation, I will do it everything. So it is our unique opportunity. Our prime minister agree, our health minister agree, and our state minister of health also very much agree. So I believe we can able to do it very nicely with the help of SCI.
If I may just follow up on that with something very quick, that, just looking at us, we're all practicing in very different countries and very different healthcare systems. So I think this has been a golden opportunity to be able to be here in Dhaka, all of us meeting together and all of us really putting our heads together on how we can collaborate. So we can have comparative data that's coming out of the US, out of the UK, Middle East, and Bangladesh, and looking at areas where there are differences and similarities and learning from each other and helping each other, whether it's in the area of research or even care and services. So I do hope that we can work as catalysts for that in the International Committee of SCAI.
Oh, that's very brilliant. I think, I mean, that's the entire mission of SCAI is to educate and to provide quality care for our patients. And this is where, coming from USA, we can actually work with each and every one of you and try to promote that on a yearly basis, and not only at a meeting, but on a daily basis with your government, as well as with the physicians who are in the working in the community.
Mamas, you may know, but by this time, Sky Bangladesh has a slogan. You know, we should connect, communicate, collaborate, and contribute for a better tomorrow. So I hope Sky International Committee is the right platform who can really work on it. We always promoting our best education, best teaching facilities, and we always help to provide our fellows to interactive case-based discussion as well as some exchange training program. Last year, from Sky Bangladesh sent one fellow from Miami Fellows course. I hope you meet with her, Tunat Jina, my fellow. That previous year, Dr. Minaz, the previous year, Asfar. So every year we are sending our fellows to US to train, to learn something, and to come back again to contribute our country. So I think if we wish, we can do it, and able to do it.
Thank you. Thank you very much. I think any last words, if any of our you know, respectful people on the podium want to say?
I'm just going to say thank you for having us in Bangladesh. It's been absolute pleasure to explore the country and the people. A lot of friendly faces, and really excited for the years to come to see where our collaboration goes.
I mean, I'd also like to extend my thanks. I think it's been a real pleasure to not only see established friends, but more importantly, meet new fellows. I think the course has been very much focused around fellows. I think it's been a real success in the sense that you've very much had your junior faculty involved. And I think the format of the course very much encourages discussions between the international faculty that you've managed to bring here with more local faculty. I think that, as we've all said, that this really is a great opportunity to foster international collaborations, penultimately for the benefit of people in Bangladesh. And I think that's the most important thing. I mean, we all go to these meetings, we all work in this arena, not for our own personal edification, but ultimately to improve cardiovascular care for the local community, the people of Bangladesh and wherever else we travel. So I hope that this meeting will impact on changes, whether it be through a registry, whether it be through training, that will penultimately benefit the community.
Sure.
Thank you for organizing such a wonderful conference. And I think we have seen 700 people. Majority of them are the eagerness and the hunger to learn is very much appreciated by all of you. Thank you very much.
Thank you very much. I really appreciate your outstanding contribution. Despite heavy pain, you joined this program and you are not bored to answer every one question. I think it is also unique experience to you. And our people are very much keen to interact with you and any new things, try to accept new things. And they really wants to translate their daily practice, what they learned in this meeting. Thank you very much. Hope to see you in the next year again.
Thank you for attending this conference today. This is the fourth SCAI Bangladesh conference. We were able to do it in great success with nearly 700 people who have attended a two-day conference on the 18th and 19th of April 2024. Thanks to you, Dr. Azam, for having us here in Dhaka city in Bangladesh.
Thank you very much for your outstanding contribution for this program.